I am Dr. V.C. Mehta. I am specialized in cataract and refractive procedures. Well, when a patient needs a cataract surgery, the patient needs to undergo certain basic blood works like the CBC, blood sugar, serum creatinine, cardiogram, etc. Although the surgery is done without an injection anesthesia, when you lie down on the table, you are obviously under stress, and therefore all these investigations are necessary. Apart from the blood test, we do a lot of measurements of the eye in order to determine the power of the lens that is to be put in the eye. There are two types of powers, the spherical and the cylindrical power. The lens that has a cylindrical power is called as Toric lens. So all these we get the information from the measurements, whether a patient needs a Toric lens or no. And the choice is given to the patient based on the patient's requirements, needs, etc. The patient needs to put certain drops as prescribed by the surgeon before coming to the hospital. This is purely a kind of an OPD procedure. You come to the surgery for the surgery, get the surgery done, wait for some time, an hour or so, and then you can go back home. There are no injection, no patches, no dark glasses. We give protective glasses so that you don't rub your eyes in the initial period. The most important precaution after a cataract surgery is not to touch your eyes, not to rub your eyes, or not to splash water in the eyes. If you feel uncomfortable and you want to clean the eyes, then there are sterile lid wipes which are available. Don't use a handkerchief, don't use anything else, because infection is very important to be controlled and prevented. Head bath is allowed after 2-3 days, and you have to keep on putting drops as prescribed by the surgeons. There are about 3 or 4 types of drops most of the surgeons give, and the frequency also is given to you. Usually the drops continue for about a month or so. You are mobile right from day 1, and you can be moderately active from day 1 also. People also go to office, people drive also, because they feel very normal after a cataract surgery. Patient for a cataract surgery not only undergoes the measurements of the lens, but also undergoes certain other examinations to find out the comorbidity in the eye. So we look at the type of cataract that the patient has, whether the pupil dilates well or no, whether the patient has any other problem like diabetic retinopathy, whether the patient has a potential of getting a full vision after a cataract surgery or no. All these are taken into account before the surgery so that we can give a good kind of a prognosis to the patient as what to expect, how much vision to expect after the cataract surgery. If these are done before the surgery, then after the surgery when the patient experiences, he is not unhappy.